Okay, so when I note that often treating the lumbar column and lateral and using the limb is advantageous, it's probably the one that's going to get you the most movement as well as the most change in my experience. This may not be the reality for all practitioners, but it works really darn good because the anatomy that I want to work on is exposed, free to move in the plane or planes required. So essentially all planes, relatively speaking. I do have the burden of control, so I don't just use the limb and wiggle her all over the place. But one of the things that you really have to do is use the limb properly to get the movements that you want. So obviously, if I'm behind the patient, generating flexion in the lumbar column is harder. I don't find flexion in the lumbar column to necessarily be something that you have to induce often. It doesn't mean you don't, I just don't find it often. In almost all cases, I'm going to find something more on one side in the lumbar column, such as a side bend or a rotation type presentation. So I'm really just concerned about getting that side to move. I would prepare the soft tissues in prone. I'd work the soft tissues in prone in most cases. If I have to work it here, I can. But generally, using the limb to work through that side. Conceptually, we can use the term unilateral extension in place of side bending. I'm often just trying to make sure that this extends, that it backward bends. So that's why the limb ends up helping me a lot. This isn't going to do it. No matter how hard I push, it's not going to do it, right? Is there something here-ish?
Yeah.
Okay, sweet. That was an accident. I didn't mean to find it, but it didn't move. So I'm like, yeah, because I checked a couple. I was like, oh, there it is. So utilizing the limb, good contact of the limb. So if I hold like this, it's floppy contact. It's really easy to lose it, right? And it's a little bit, it's not necessarily hard on my arm, but it's just really easy to lose it. Like, look, if I don't control the pelvis, everything's going all over the place. Here, nice and locked in. I can get compression. I can get distraction should I need it. I can get good distraction. Okay, so you see the difference in the hand? So I can get some distraction here, but it's a little sloppy. If I go here, I get good distraction. If I go here, I get good compression, depending on what I need, right? So let me figure out. So if I try to get extension here, right? So first I actually have to make sure that the hip's okay. So you'd agree that there's some tension in that hip. Mm-hmm. Okay, so before I work on the back, I want to work on the hip. So I'm perpendicular relative to fiber direction going this way. I feel tone in the hip. So if I just pull back here, that's not that nice. You fight that a little bit here. Is that fair? Mm-hmm. If I come up here, you don't fight it anymore. Fair? Yeah. Right? So I'm looking for that sweet spot whereby I can work on what I found with hip extension before I go after the back. And I'm working perpendicular to fiber direction, still muscle, moving bone. But I don't want to do it down low because if I do it down low, she fights. So I want the or the abduction, the abduction. In this case, in some cases, I actually have to go way down there. Just depends on the circumstance. So we work it, and then I could say, oh, I completely feel the release. I'm constantly altering what I'm doing to pay attention to how she's responding. So I don't actually feel the release in almost any case. I assume that there's going to be some change, and then I check it. So if I come back down here, I let off the hold a little bit. That feel like it's moving a little bit better. Mm-hmm. It's not perfect. There's still a little bit, say, here-ish. Mm-hmm. Yeah, so we'll work that. I changed my hand. So some of it's inferred identification because my hand's not right on it, but as I pull, I use my eyes, or as I move the limb and I use my eyes, I can feel some resistance and I can see something. So I triangulate those and I go to it. Sorry. Minor fight there. It jumped a little. Yeah. So as I'm moving, if I feel that muscle do something, I'm like, yeah, I didn't do it right. So I have to change what I'm doing. Sometimes change position, sometimes change speed, sometimes change direction, sometimes all three. Feels pretty nice now. Mm-hmm. Okay. Yeah. Now I want to check in the back. So that you feel that in your hip more, the front of your hip more than anything else, right? If I go here, yeah, even more in the hip. Like, or you said better?
I think so.
Yeah, that's fine.
I felt like it was more of a pull here initially, but now that you're higher, not so much.
So now I'm going to add the compression. I'm going to add the short lever. So see, that looks like a roll if I do it wrong. When I add the compression, and actually, yeah, when I bring it up now, I get more into the back. right? So if I do it here, if I just go for that, you feel that in the hip. Like it moves a little bit, the back moves, but you feel it in the hip. Once I come here, and sorry, that was fast. If I come here, in this case, so there's some of my hand causing movement of the tipping of the pelvis here. I'm short lever going to push PA or posterior to anterior, but that compression as well, and searching for where it does it. Right, so as I say, a little this, a little that, depending on the person. Right, so just to see this, squish, squish, push. Okay, so remember, it's not about the specific details of what my hand is doing or the specific details of what I just did. It's I need to test to see what she responds to. I'm going to describe what I did. It's not about the what I did. It's about that I looked for it in some organized fashion. You know, the adduction, the abduction, the adduction, the extension, the short lever, right? My hands are doing multiple things to try to find the sweet spot where she'll respond properly. It's not about the specific things I did. It's about the search pattern, okay?